Hello, our topic is on vitamin D deficiency and schizophrenia, investigating the disconnect from reality. So, let's begin with a quick summary of vitamin D. Vitamin D is a fat-soluble vitamin essential for normal growth, calcium absorption, skeletal development, and modulation of gene transcription. The production of vitamin D depends on the action of sunlight on the skin, where ultraviolet B radiation will eventually lead to the production of vitamin D. Subsequent hydroxylations in the liver and then in the kidney result in the active version 1,25-dihydroxyvitamin D3. Deficiency of vitamin D can lead to rickets in children or osteomalacia in adults, which is softening of the bone. It can also lead to bone pain and neurological or neuropsychiatric disorders. Which leads us to schizophrenia. Schizophrenia is a severe, chronic, and generally disabling brain and behavior disorder. It is most accurately described as a psychosis, which is a type of illness that causes severe mental disturbances that disrupt normal thoughts, speech, and behavior. There's a lot of research that has gone into determining the cause of schizophrenia, and one aspect of this is vitamin D deficiency. This may seem obvious, but vitamin D production is strongly associated with the duration of the photoperiod, or time of sunlight exposure, which is influenced by two things, season and latitude. People born in winter or early spring actually have a small occurrence, but a significantly increased risk of developing schizophrenia. Also, it has been found that there is a strong tendency for increased schizophrenia prevalence with increasing latitude. The effect of this association increases as distance from the equator increases, which makes sense due to the difference in sunlight exposure. It even turns out that there is an increased prevalence of schizophrenia in urban settings, which is probably related to sunlight exposure as well. Epidemiological studies have also implicated that 25-hydroxyvitamin D deficits are a risk for psychiatric illness, in particular susceptibility to schizophrenia. And because vitamin D deficiency is more prevalent during winter and early spring in dark-skinned migrants living in cold climates and in urban versus rural settings, these converging clues led to the hypothesis that vitamin D deficiency may be a risk factor for schizophrenia. One of the mechanisms discovered to link vitamin D deficiency and schizophrenia is through hyperprolinemia. Hyperprolinemia is an excess of the amino acid proline in the blood. This condition generally occurs when proline is not broken down properly by the body. Proline acts as a neuromodulator and glutamate synapses. Hyperprolinemia has been associated with decreased IQ, cognitive impairment, and schizoaffective disorder and schizophrenia. The link between vitamin D deficiency, hyperprolinemia, and schizophrenia is proline oxidase. Proline oxidase, or dehydrogenase, is an enzyme that is required for the production of 1,25-hydroxyvitamin D3 from 25-hydroxyvitamin D. Most importantly, though, proline oxidase catalyzes proline catabolism. The research shows that schizophrenia risk may be mediated by proline elevation rising due to 25-hydroxyvitamin D deficits and the resultant decrease of proline dehydrogenase gene expression. This table is a summary of the results of one study and shows that plasma proline levels were directly correlated with plasma vitamin D levels. It also shows that vitamin D insufficiency was significantly associated with the rate of schizophrenia. This graph from one of the experiments gives a good visual association of hyperprolinemia, vitamin D levels, and schizophrenia. Vitamin D levels are plotted for controls, which are the white, and patients are the blue by proline status. The dashed line represents the threshold level for vitamin D insufficiency. You can see here that the odds of vitamin D insufficiency were significantly different across groups and compared to non-hyperprolinemic controls. Hyperprolinemic patients were significantly more likely to be deficient in vitamin D. Subjects with hyperprolinemia were shown to be 6 times more likely than subjects with normal levels of plasma proline to have schizophrenia. Another study showed that even prenatal infant vitamin D deficiency resulted in changes of future adult brain structure and neurochemistry. The infants with low vitamin D status had a significantly increased risk of developing adult schizophrenia. Research has shown that vitamin D is a potent transcriptional modulator and can regulate proline dehydrogenase expression. So the proline dehydrogenase gene maps to chromosome 22q11, which encodes the enzyme I mentioned before, proline oxidase, and catalyzes proline catabolism. One research summarized that 25-hydroxyvitamin D insufficient subjects had 3 times greater odds of hyperprolinemia than those with optimal levels, and formal testing established that hyperprolinemia is a significantly mediating phenotype that may explain over a third of the effect of 25-hydroxyvitamin D insufficiency on schizophrenia risk. If vitamin D is not available to regulate proline dehydrogenase expression, proline oxidase is not created and is not able to catabolize proline effectively. Proline then builds up in the blood, leading to hyperprolinemia, which is shown in our research to be associated with schizophrenia. It has been shown that elevated proline levels in the brain decreases sodium and potassium ATPase and acetylcholinesterase activities and elicits oxidative stress. In conclusion, further investigation is needed to fully understand the different underlying exposure-risk relationships that reflect genetic variation and confounding factors, because some research showed differing results. One study actually found that both low and high concentrations of neonatal vitamin D were associated with an increased risk of schizophrenia. Some research showed that the vitamin D is important in many functions for proper brain development as well, such as how vitamin D deficiency negatively impacts dopamine neurons and their positioning. Deficiency also increased metabolic rate of dopamine, which affected neurotransmitter turnover. So we can apply this by being aware of geographic location and ethnic background of our clients. The people at a greater risk of deficiency are dark-skinned individuals, people that reside in higher latitudes, and those born in winter and spring seasons. More research is needed to recommend vitamin D supplements, but vitamin D deficiency is prevalent in many societies and is a particular concern in pregnant and lactating women. The current RDA for pregnant and lactating women is 600 international units. Thank you.